I grew up in a family with the medical specialties, and my father was a doctor. I was interested in the chest and the heart, those kind of things, so I dived into the chest surgery. I've been working on a chest wall deformity surgery for the past 25 years. We had a lot of patients who wants to correct their chest deformity without any scars, or just make it natural and intact chest wall. They have some symptoms like breathing difficulties and lack of stamina, and then basically from the insufficient blood circulation to the body and the brain. It's a congenital deformity, so we see a lot of younger kids and sometimes a newborn. I recommend the operation when they need it, so like after 5 years and 7 years, 10 years, which age, because of their appearance on chest. They don't like it, and they don't want to show it to anybody. So they have a lot of emotional and psychological stress. We can discuss how can you fix your chest for improving your circulation. And then another very important target is to restore your chest wall to the normal position. There are different options there, but like a suction cup is already available, but that's a kind of partial, just a little bit of improvement. It's a closed, so-called minimally invasive approach, specially designed the Pectus bars to support it and then maintain the position for a couple of years, and then we can remove the bar later on, so we can maintain the very natural and complete correction of the chest wall deformity. Their chest wall rises, the emotional happiness rises together. It's a very, very rewarding work, because I see them before surgery and after surgery. I can see there's a tint of a smile in their face. They keep looking at the mirrors on their chest. Yeah, they are much happier, and that they can be to their normal, entirely normal life. Out of operating room, I enjoy listening to music. My son is a violinist, so I learned a lot from him, classical music.